Welcome. Today we are presenting an educational video on Dermarite foam dressings. We will be discussing the dressing features as well as application tips. What are foam dressings? Dermarite foam dressings are highly absorbent dressings made from soft polyurethane foam. The dressings are capable of absorbing moderate to heavy amounts of wound drainage. Foam dressings are non-adherent for easy removal. Many foam dressings have a waterproof backing to keep the wound drainage contained within the dressing. Others may have adhesive borders to help secure the dressing over the wound. Foam dressings come in a variety of shapes and sizes. How do foam dressings work? Foam dressings absorb moderate to heavy amounts of wound drainage. These dressings keep the wound close to body temperature to support wound healing, while protecting it from bacterial contamination, soiling, or trauma. The dressings are non-adherent to help prevent the dressing from sticking to the wound. Dermarite has two foam dressings that do not have an adhesive border, Dermafoam and Hydrofoam. Dermafoam has a backing that will keep drainage contained within the dressing. The white side of the dressing should be placed next to the wound bed. The backing allows the dressing to be worn as either a primary or secondary dressing. Dermafoam will need additional securement, such as tape, to keep the dressing securely in place. Hydrofoam does not have a backing, and either side of the dressing may be placed next to the wound bed. Hydrofoam will need to be covered with a secondary dressing as directed by your healthcare provider. Both Dermafoam and Hydrofoam absorb moderate to heavy amounts of wound drainage. The dressings may be cut to fit the wound as directed by your healthcare provider. Dermarite has two foam dressings with an adhesive border, Dermaleven and Border Foam. Both dressings have waterproof backings that keep wound drainage contained within the dressing, preventing leak-through drainage. The dressings have an additional adhesive border, which keeps the dressing securely in place without additional tape for easy, convenient application. The foam dressing is placed next to the wound with the backing facing away from the wound. These dressings should not be cut. Follow additional instructions from your healthcare provider on application of these dressings. Dermaleven is designed for wounds with up to moderate drainage, while bordered foam is used for wounds with moderate to heavy wound drainage. As you prepare to apply a new dressing, gather your supplies together on a clean working surface, and then thoroughly wash your hands and apply gloves if available. Before applying the new foam dressing, clean the wound as directed by your healthcare provider. Each package has step-by-step instructions to help you apply the dressing. Follow any instructions given by your healthcare provider related to dressing application. Some tips that will help you apply adhesive foam dressings, such as Dermaleven and bordered foam. Each package has step-by-step instructions to help you apply the dressing. Place the foam dressing over the wound. The waterproof backing should be on the outside of the dressing, away from the wound. Do not cut Dermaleven or bordered foam. Foam dressings are single-use products. Do not reuse the dressings. Always consult your healthcare provider for specific application instructions. Some tips for Dermafoam dressing application are: each package, again, has step-by-step instructions to help you apply the dressing. Place the foam over the wound. The backing should be on the outside of the dressing, away from the wound bed. Non-bordered dressings, such as Dermafoam, can be cut to fit the size of the wound, as directed by your healthcare provider. Foam dressings are single-use products. Do not reuse the dressings. And always consult your healthcare provider for specific application instructions. Like Dermafoam, Hydrofoam can be cut to fit the size of the wound. However, either side of the hydrofoam dressing can be placed next to the wound bed, since the foam does not have a waterproof backing. Hydrofoam is the only Dermarite foam dressing that requires a secondary dressing covering because the dressing does not have a waterproof backing. Dispose of used dressings. Never reuse a foam dressing.
After you have applied the new dressing and discarded the soiled, used dressing and gloves, be sure to complete the final step and wash your hands thoroughly. For more information on the Dermarite products, visit our website at www.dermarite.com.